Welcome back. Now, over 70% of children and youth felt they needed mental health support over the last year. This has been revealed in the latest Unicef South Africa U Report poll. A mental health roundtable is set to take place in mid-November with young people, government, civil society, academia and the private sector. To discuss this further, we're joined by Unicef South Africa representative Christine Muhigana. Thank you so much, Christine, for your time here on all angles. Of course, especially now that we're looking at the fact that it's exam time during this period. A lot of young people are already anxious about that. But tell me why those 73% were saying that they're going through mental health issues. What did they say is causing this?
So a good proportion of the young people are saying that their anxiety is related to school performance, so they are eager to succeed. Others are citing the fact that they need to have the skills required to find a job out there. And it's also about, the environment in which they are.
So, mental health is something that at some point organizations such as the South African Depression and Anxiety Group was saying is something that is downplayed because we look down on people who have mental illness, right? But in fact, we don't know that every day we live with a mental illness. I mean, you might have been mugged yesterday and now you're going through anxiety every single day of your life because every situation reminds you of what you went through. And that anxiety is also a mental illness. So I think maybe it's also a conversation around it for us to normalize the fact that we go through mental illnesses so that people are not scared to say, I'm frustrated or I'm anxious about something.
Absolutely. We need to make sure that, people understand what mental health means. There is a wide spectrum of mental illness. As you said, it can be, very small anxiety related to, everyday pressures of life, all the way to, more serious mental issues that require psychiatry or, more serious psychological support. And the earlier it is managed, the earlier it is talked about, the better chances there is to be able to address it. And the good thing about the poll whose results we have now is that it shows that over last year, when we had conducted a similar poll, young people seem to be more open to talk about it. They seem to be more knowledgeable about, what mental health really means, and the fact that there is no reason to be ashamed or, have a stigma attached to it, even though there is still some of it.
Talking about the stigma, Christine, I don't know about any other part of the African continent or the world. South Africa, the World Health Organization has already warned so many times. I think year in, year out, the World Health Organization warns South Africa about the fact that our government doesn't actually put enough money into mental health. And this was, of course, revealed after the Life Esidimeni tragedy, where we started concentrating on what this is and why those patients were just let go so easily, as if nothing had to be done to investigate their wellness after moving from those centers. But how are we looking as South Africa in terms of how much we budget for mental health? It looks like it's something that we actually, think of much later when there's a tragedy.
Yeah, I think it's a global issue. It's wider than South Africa, and certainly in Africa, the stigma around mental health is there. But a good thing, if anything good, came out of the COVID-19 pandemic is that because this issue or this the pressures on mental health people on people was so widespread. It's more talked about, and the government entities, civil society, academia. We collaborated with the University of Cape Town on an issue of the child gauge that's related to mental health of children and adolescents. So there's more investment, there's more resources that go into it, and which means that government, public institutions, but also private institutions, communities themselves will be investing more, will be talking about more about these very critical and important issues, and investing more in addressing them, particularly as they relate to children and young people. Because as we were saying at the beginning, the earlier you detect that there is an issue, the bigger chances you have to address it and make it so that it doesn't develop into a serious psychiatric issue.
And if we don't concentrate on something like that and start to improve it, I mean, the fact that already 73% of the youth in South Africa says it needs mental health intervention. If we don't look after the youth that is going through mental health and is willing to admit that they're going through mental health, what kind of adults are we going to have in a few years' time?
That's exactly the issue. We need to invest in these young people's, children's mental health as much as we invest in anything for young people and young children, be it education, nutrition, their health, because that's how our country, our societies, our communities will develop. We need the communities to have productive, healthy, well-balanced individuals in order for the country to develop. So if you do not invest in such an important dimension of people's health, you run the risk of losing out on very important resources for the development of the country.
Did these young people say anything, Christine, about the possibility that burnout, which is also a mental health illness, was burnout also part of their concern for their final year exams and how they'll perform at schools?
That particular question was not asked in those terms, but they clearly said that, or reported that succeeding in their education is something that is very high on one of the reasons that causes them anxiety.